Good evening. My name is Sandra Valtero and I'm your host. This is Be Prepared, and tonight we are featuring the second half of vaccines and the importance of them and how we can be prepared to protect ourselves from diseases. And tonight back with us again is Dr. Donald Craven, who is an infectious disease medicine doctor who practices here in Burlington at the Lay Hospital and Medical Center and also at Tufts Medical Center. He also specializes in infections that are difficult to diagnose or are unresponsive to treatments such as HIV or airborne infections from a foreign country. The International Association of Healthcare Professionals has welcomed Dr. Craven to their prestigious organization with his upcoming publication in the leading physicians of the world. Dr. Craven has been in practice for more than 4 decades and is currently serving as chairman of the Center for Infectious Disease and Prevention for the Leahy Hospital and Medical Center in Burlington. In addition to his clinical work, Dr. Craven serves as professor of medicine at the Tufts University Medical Center and Tufts University School of Medicine. He is board certified in infectious diseases by the American Board of Internal Medicine and maintains a professional membership with the Infectious Disease Society of America. For his hard work and dedication, Dr. Craven received the Kenneth Kaplan Award for Excellence in the Practice and Teaching of Infectious Diseases from the Massachusetts Infectious Disease Society. Thank you, Doctor. Welcome.
Thank you.
And next to him is Dr. DeMaria, who is a medical director of the Bureau of Infectious Disease and Laboratory Sciences in Massachusetts at the Department of Public Health and State Epidemiologist for Massachusetts. He has been involved in applied epidemiology, public health surveillance, and public health practice for over 26 years. He is a graduate of Boston University and Harvard Medical School. He trained in internal medicine at Montefiore Medical Center in the Bronx, New York, and infectious diseases at Boston City Hospital. He also had a private practice prior to that at the staff of Maxwell Finland Laboratory for Infectious Diseases and the Boston City Hospital. He is a fellow of the Infectious Disease Society of America and the Society for Healthcare Epidemiology of America. He is a past president of the Council of State and Territorial Epidemiologists and Northeast branch of the American Society for Microbiology. He serves as a member and advisor on several committees of the Massachusetts Medical Society and is on the board of Public Health Museum. Welcome.
Thank you.
All right, gentlemen, as before, we talked very much about the importance of vaccine, and tonight we're going to continue on further. Let's talk about why do we hear about vaccine shortages?
Well, yeah, vaccines are very difficult to produce, and the return on investment for the pharmaceutical industry is limited because, they can make a drug like a statin, like Lipitor, and people take it for the rest of their lives, so there's a guaranteed market. But with vaccines, there's less utilization. You get it once, you get it twice, you get it 3 times, and that's usually it. So there's not a lot of incentives. So unfortunately, over the years, a lot of companies started getting out of the vaccine business. Now that's improved somewhat because some of the liability concerns have been taken away by the Vaccine Injury Act. But still, some vaccines are only made by one manufacturer in the United States. So it's a very vulnerable, critical product in the United States and worldwide as well. So we're always concerned, and sometimes because there is limited supply, if there's one problem in one of the manufacturing facilities, it could endanger the supply of that vaccine for the entire country. So what's been happening is the federal government is trying to encourage more vaccine production, more companies getting into it, and so that we have fallbacks for shortages. But so people have heard about certain shortages in vaccines over the past few years. There was a shortage in the varicella vaccine, the chickenpox vaccine. There's been shortages in some of the other vaccines, but there's a concerted effort now to try to diversify the market and get more manufacturers to produce vaccine. Because it's a critical supply, because vaccines are our best way of preventing disease.
Right. So we are hopeful, though, there'll be more people getting into manufacturing them?
Hopefully,
Yeah.
yes.
Let's hope so. Why do we get some vaccines once and others require boosters, Dr. Craven?
Well, there are certain diseases like influenza that change from year to year, so that if you're going to get a vaccine, they try to estimate what the most likely, the best flu vaccine that they can make, but it changes from year to year, so that there are certain diseases where the agents change, whether they're viruses or bacteria, where basically the vaccines may not work as effectively as they should. But in general, for a lot of the other diseases, most of the vaccines will stay. But flu is sort of the typical example because the flu virus changes from year to year, and the vaccine has to be made up a long period of time before and then distributed. So that usually it comes down to guessing, and that most of the time they guess right, and the vaccine is good.
Yeah, was it last year that was one of the strains that weren't covered, or
I think it was
Yeah.
actually the
year
year
before?
Yeah, the year
Yeah, and then
before.
last year we corrected it
Yeah.
or
That's
something.
That's right.
Yeah, that's very interesting.
But it's too late. By the time
Yeah.
you're really into flu season, you can't start manufacturing a new vaccine at that time, distributing it, et cetera. So,
Right.
but in general, it's pretty impressive that most of the time they're on target for the likely strains to be covered during that flu season.
Well, there was polio, wasn't it, that you had to get a booster shots? Are you still doing that with polio?
Well, they're
yeah.
starting to transition from the live polio vaccine to the injectable vaccine, and there are different strains of polio virus, so you do have to get the multiple strains. In fact, one has just been eliminated because it turned out that it was pretty much essentially eradicated, and people were having more problems. The very small proportion of people who get a problem with the polio vaccine there were more of those people than there were actually cases, so they phased it out at that point. But you do need to get multiple injections to assure that you're getting an effective immunity.
And are there other diseases that you need boosters for?
Right, yeah, there's some infectious diseases like whooping cough. We're finding that even with the current recommendations, there are whooping cough cases coming back. And so that the vaccine that we switched to about 17 years ago, because there was too many reactions to the whole cell vaccine, which was the old vaccine, we switched to a cellular vaccine that causes less reactions to the vaccine. That was a problem with the vaccine.
Yeah.
And unfortunately, though, it doesn't provide the same kind of durable protection. So we have to figure out a new way to boost people's immunity so that if they are exposed to pertussis later in life, they don't get pertussis. Because pertussis can still be a very severe disease in infants. It can be life-threatening in infants. So, people see those commercials on television about pertussis vaccine where the grandparent turns into a wolf, kind of melodramatic. But the point is that if you're not adequately protected, you could bring this organism, you can bring this infection to your grandchildren, to the baby, and we don't want that to happen. So now every pregnant woman should get a shot of pertussis vaccine during their pregnancy to protect that infant, and everybody around that infant should be protected from pertussis, from whooping cough, to protect that infant.
Are the doctors prescribing that
Yes,
to the mothers
actually, we
now?
have very good compliance in pregnant women. So most
Wow.
pregnant women now are getting that shot every single pregnancy to protect their baby, because who wouldn't want to protect their baby from a potentially serious
Right.
infection?
Oh, that's scary. What about shingles? I mean, people are worried who has to have the shot, who doesn't have to have the shot. You want to talk about that, Doctor?
Well, I think shingles is a common disease. There's a vaccine out that's effective in preventing it. Generally in older people, as they start, their immune system starts to wane, they really can benefit from having shingles vaccine as a reactivation of the virus that they have had for a while that can come back again. So the shingles vaccine, I think, is very good. It doesn't generally need to be updated, but it's important for elderly people to get a booster dose that will protect them from having a relapse or having shingles recur again.
Oh, you recommend a booster shot?
Mm-hmm.
Now, is it people who have had chicken pox are the only ones that have to take it, not people who haven't had chicken pox?
I don't know. I think
Right.
generally speaking,
Yeah.
Is
it's
that
most people
correct?
that have had chicken pox are people that have it. It lays dormant for a long period
Right.
of time, and then can come back, particularly as the immune system, as you age, your immune system starts to wane, and then it becomes, it can be reactivated, and it can be very severe, depending on what nerves, where it's
I think
been.
we have a picture. Oh, there she is.
Yeah, there's a
Yeah.
picture here, basically, of a woman with
Is that
shingles.
shingles?
That's shingles
Wow.
involving her forehead and her right eye. It
So
can
she
be
could
any
lose
place-
vision in that eye.
That's right. It
Wow.
can be very serious, and it can be in any part of the body. It can be in the back, the legs, and it's particularly severe in and around when it's in the eye.
Painful.
Painful.
Is
and
it
it's
contagious
extremely painful
when
to
someone
have
has
because
it
it
on
goes
them?
down a nerve route, so it
Yeah.
It'll
causes
give you chicken
tremendous.
pox.
It'll give you chicken
Chicken
pox
pox.
if
Yeah,
you're
but
around
not,
someone.
not
reactivation.
shingles.
I see.
Yeah.
But then you'll need the shot because now you have chicken pox, right?
Well, you
Yeah.
presumably, most people have already had chicken pox, so
I never had, that's why I
if you
say.
haven't had chicken pox and you're susceptible to chicken pox, being exposed to somebody with shingles can give you chicken pox.
Oh.
And
Yep.
then years later, you could get shingles because you got chicken pox.
Oh my goodness.
It's
gracious.
So
actually
it's better to prevent both of those with vaccines.
You mean to say someone should still get the shingle shot? Because
No,
I
if
was
you-
told not to.
If you never had chicken pox, you should get the varicella, the chicken pox vaccine.
The chicken pox vaccine. Oh. Maybe I'm just immune to chicken pox? No?
Well, some people have had chicken pox and they don't know it. You can get your blood tested for the antibodies.
Ah. Okay, that's interesting. Because my kids never got it either, the chicken pox.
Yeah, if you had never gotten it, your children got it, you would have got it.
You're
Yeah.
probably safe.
Yeah, no,
Yeah.
they never got it, so that's good. Okay, we hear a lot on TV about taking the pneumonia vaccine. Why is that important?
Well, pneumonia is still one of the major causes of death, especially in older people, especially over 75, but that increased risk starts when you're 50. So you can get pneumonia. It can be a very severe illness. It can be a life-threatening illness, but most of it is preventable now. And that's a major achievement because until recently, there have been pneumonia vaccines around for a long time, but now there are highly effective pneumonia vaccines that are called conjugate vaccines that give you a very good immune response. There's still some of the older vaccine, and that gives you a broader response. So the actual recommendation is now you get both. You get the new vaccine, the conjugate vaccine that gives you a good immune response first, and then a year or so later, you get the second vaccine. This should be after you're 65. There's a lot of confusion about that because sometimes people get pneumonia vaccine before they're 65. Should they get it again? Which vaccine should they get first? And it's actually kind of simple. If you've never gotten a vaccine, you get the PCV13 vaccine, the new vaccine. If you've gotten the other vaccine before, you still get the PCV13, and then you get a dose of the other vaccine a year later. And Medicare Part B will cover that now for both doses as long as there's 11 months, at least 11 months between them. And people really should get that because it's something, you don't get around to, and, then you develop pneumonia, and it could really cripple you
Yeah,
when it should be preventable.
that's good to know. That's good information for people to know, actually. Now, what about whooping cough? Is that really increasing even though we have vaccines?
Well, we've been seeing an increase in adolescents and younger children, and we think it's again because we went to a vaccine that caused less reactions, but is probably less effective in the long term. So basically, we're reevaluating the recommendations for boosters. There's been boosters for quite a while, recommending when those should be given to maintain that immunity, it wasn't an expected problem, but it's something that once it became noticed has really drawn a lot of attention to trying to figure out how to prevent that, because every year there are a few babies that die from pertussis, from whooping cough, and those are preventable if we could just figure out a way to make sure that those babies are not exposed. And that's why, a lot of people say, well, I get whooping cough, what do I care? I'm healthy, I'm not gonna. But if you brought it home to someone who was compromised,
Right.
whether it's an infant or somebody who's on chemotherapy or immunosuppressed in some other way, or just elderly and they got whooping cough with complications. You'd have to live with that.
It's been around for many years. I remember it back in the 50s.
Oh, it's been around for probably
Yeah,
thousands of years.
yeah, so
Yeah.
you would think by now we wouldn't be seeing
Well,
them.
the problem is these organisms live in our throats, despite the fact that we got vaccine. So the vaccine prevents them from invading us, but it doesn't prevent them from getting into our throat.
Ah,
So
I see.
that's and if it gets into your throat and you're not immune, it can invade the tissues in that line the airway and cause this very irritating inflammation.
Yeah. Wow. That's good to know. Do you think we'll have a vaccine for Zika?
I don't know
What do
what
you
the
think?
state. I don't know what the state of the art is now. It's obviously a huge problem that is spreading through the Caribbean, southern parts of the U.S. So there definitely is going to be a need for a Zika vaccine. I know there's a lot of work being done on Zika vaccines. I don't know exactly where they stand now. You may have a better idea. There's a lot of interest, and it's going to be an important factor because these mosquitoes are going to be moving up up into our area over time, and that we're eventually going to need a vaccine, and it can be a terrible disease. So
Yeah.
that, I'm not sure exactly what the state of the art is, but
Well, I think there are several vaccines in development, and I think there wouldn't be as big a concern about Zika. We've had other viruses like dengue and chikungunya that have the same sort of mosquitoes that transmit them, but less severe concern. The real concern is the effect on the developing fetus, on the baby, and the
Yeah.
birth defects that the Zika virus can cause. So I think people are looking towards having a vaccine to protect pregnant women who have to travel to areas where there's Zika. And as Don says, this is moving north. With global climate change, we're starting to see the kinds of mosquitoes that basically transmit these viruses in the tropics moving north. And now we have the Asian tiger mosquito in Massachusetts, breeding in Massachusetts. So that's one of these potential vectors for Zika virus, yellow fever, not so much yellow fever, but chikungunya. It has some capacity, not as much as the yellow fever mosquito, but the Asian tiger mosquito has some capacity to transmit these infections. So you could have a situation where pregnant women could be sitting in her yard, neighbors come over, they just got back from the Caribbean, one of them has the Zika virus in their blood and doesn't have any symptoms because 80% of people with Zika doesn't have symptoms. One of these Asian tiger mosquitoes can bite the person with the Zika and transmit it to the pregnant woman. And who would have known that would happen? I think it's remote. It's a very remote possibility.
Yeah.
The vast majority of people are getting Zika where these mosquitoes, the yellow fever mosquito is around. But it's a theoretical concern that we're concerned about and we're on the lookout for, and we don't want to happen. So if there was a way to prevent Zika in pregnant women beforehand, that would be very attractive to many people.
We're having trouble with Zika down in Florida last year, was it?
In Miami
Yeah.
Yep, in Miami.
Is
It's,
that
I guess it's
gone now, or-
actually
and
been spreading
Brownsville.
up the coast, so there is some movement up
Yeah.
the coast and along
We hope it doesn't come up here, right?
It's going to be a long time before that happens, but someday it will happen
Yeah.
with the way
Global
global
warming.
climate change is happening, and the temperatures are increasing, and the humidity is increasing, and the water table is increasing. It's all designed to foster the development of these mosquitoes.
Wow. So are they working on a vaccine?
Yes, there are several
Yeah.
several products in development. There are actually clinical trials I think have started.
Oh, that's excellent. Yeah, great.
Now, what about for Ebola? What's your
Ebola is another, people didn't pay much attention to Ebola because it was occurring in rural parts of Africa in small villages and not spreading. But what we saw in 2013, 14, and 15 was this massive epidemic in West Africa in what was becoming an urbanized society, and with a lot of travel, a lot of people moving around, and a lot of potential for spread of Ebola. An Ebola vaccine is a possibility. There's one that looks very promising. It was actually tried during that epidemic, but because Ebola is under control now, there's no way to test a vaccine like they tested it the year before last. So
Yeah.
if there's an Ebola outbreak again, they'll be using this vaccine experimentally to try to prevent, because even though the mortality of Ebola is much less than the 90% that used to be associated with Ebola when it was occurring in rural, areas that out of the way places, this outbreak of Ebola had a lower mortality rate, more like 60%, which is terrible, but lower. And having a vaccine is still going to be a critical part of control.
Yeah, why
Because
is it?
vaccines are the best way to prevent disease.
Right.
They got this under control, but with a vaccine, it would have been so much easier and so much more effective.
Oh, sure. Yeah.
It's tough in Africa, though, trying to get vaccines into the different communities and where they are, because people are living in a very different environment, and it's much more difficult to try to get them out vaccinated, prevented.
But the good thing, I think people there, they've seen the consequences of the vaccine preventable diseases, and they'll walk 10 miles with carrying their baby to get them vaccinated because they know what can happen to that baby. I think in our country we're sort of lulled into a sense that no big deal. We don't see these diseases. We don't see them because we do a good job of vaccinating. If we stop doing a good job of vaccinating, like they did when the Soviet Union broke up, their public health system deteriorated, and all of these diseases came roaring back because they stopped their very effective vaccine campaigns with the breakup.
Yeah, that's good. So how are we doing with tick-borne diseases? What are the trends?
Well, because we don't have vaccines, they're
Yeah.
epidemic. So we have
See?
epidemic Lyme disease, epidemic babesiosis, the parasite that's transmitted by these ticks, epidemic anaplasmosis. Now,
they're all,
Dr. Craven can tell you that at Leahy Clinic,
We've had at a lay clinic, what?
Oh, there's so many cases coming out. Babesia, we're working with Tufts on a Babesia program, but the numbers of cases are just enormous this year. It started out very slow, but it's just taken off. And the same way these other viruses, basically the Lyme disease and anaplasmosis is another tick-borne disease. So these diseases are very prevalent this year, and we're seeing certainly a lot more babesiosis than we've seen previously, particularly on the Cape and Martha's Vineyard and Nantucket and some of the other areas. But it's spreading quite rapidly, and there are a lot of
and we're
cases
counting
from-
cases, double-digit increases every year.
Wow, yeah. And you had what was that one down in,
Powassan?
yeah,
Yeah, Powassan actually,
up here too?
again,
It's
Leahy
actually a
Clinic
case.
was at the lead in describing that infection.
Scary. But they're all over. I mean, really. I mean, even people who spray, they find they're still getting on their dogs and bringing them in the house. And
Yeah, until we figure out how to break the ecosystem of the deer, the mice, and the ticks,
yeah.
and we learn how to control that, I think it's going to be a problem.
I see that. And what are some new vaccines that are coming available, like hepatitis, HIV, herpes? Any of these vaccines coming available soon, do you think?
Well, one vaccine is a new HPV vaccine that gives broader coverage and to prevent cancer. And I think many people think of it as a vaccine to prevent a sexually transmitted infection, which it is. But the fact is that we really use that vaccine to prevent cancer, and that's why we want to vaccinate children early, because it's before they could possibly be exposed.
Right, absolutely.
Hopefully.
That's good that we have that today.
And then where it's been used, there was two vaccines. The first one was HPV-4, and then there was a new vaccine called HPV-9 that has more strains, better protection. And where that's been used, there's been dramatic drops in HPV disease. So I think that it's important to, one, use the HPV-9 vaccine. It has more protection, but it's definitely going to be an improvement over the previous vaccine that also was quite effective when it was used compared to placebo.
Oh, of course.
Yes.
Yeah. Absolutely. Well, this has been great. We're running out of time. All I can say is that we have a lot of work to do for the public in getting out more vaccines because, as you say, like things are spreading and getting worse as far as the tick-borne diseases, especially, it seems, and among other things. And
There's not many things you can do to prevent. You do it once or maybe twice or 3 times, but and then you're protected. And so you don't have to like put on a repellent. You don't have to, dress up in an unusual way. You don't have to take other precautions because the vaccines are so effective.
that's great. So we need more of them. So
You may have to do all those other things for the things we don't have vaccines for, but not for the ones we do.
that's true. That's very true. Well, I wish we had more time, but I'm afraid we don't, because I'm sure there's an awful lot more we could always say about these diseases and how vaccine can help us stay well and survive, actually. So everyone, we need to be prepared, and that's what our show's about. So thank you so much for joining us, and I want to thank Dr. Craven and Dr. DeMaria for joining us both months and giving us all this information. And I hope everybody will tune in and watch these shows, and please help your families get what they need. Go get your vaccines. Thank you very much. My name is Sandra Valtero, and this is Be Prepared. Good night.
Hey,